Zongertinib is a irreversible TKI that selectively inhibits HER2. It spares wild type EGFR. And we clearly have emerging data with this compound, both for patients who are pre-treated as well as treatment-naive patients who have tumors that harbor HER2 exon 20 mutation. The cohort 1 were patients with tumors with a HER2 tyrosine kinase domain mutation. Patients were treated at 2 different doses of zongertinib. And then the dose that was selected was 120 milligrams moving forward. And we saw in cohort 1, and again, these were patients that were all HER2 exon 20 and had not received a HER2-directed therapy, a response rate quite high, north of 70% here. Disease control rate quite high as well, of 96%. And again, these were patients who had prior treatment but had not had HER2-directed therapy. Quite exciting to see this compound in pre-treated patients and make the New England Journal of Medicine just a few months ago. I'll just looking at the univariate analysis, it seemed like all the patients benefited. And certainly importantly, patients with brain metastases seem to derive a benefit. Well, we know these tyrosine kinase inhibitors can cross the blood-brain barrier. We've seen that. This drug is this drug demonstrates similar findings. Looking at the duration of response, 14 months, and then looking at progression-free survival, a median of 12.4 months. Pretty impressive to see this again in patients who were pre-treated, who were receiving this drug. So really important initial data that had come out, and quite exciting to see.